Hello everyone, it's me again, Nurse Clari. In this video, I would like to summarize the nervous system injury before we move on to our next topic, which is epilepsy and the seizures. This is really the way I review things. I want to wrap it up and then provide sample questions about that topic so that we will know that you already have a grasp, or should I say you already grasp the topic really well. So first of all, let's discuss first the head injury, which is still under the nervous system injury. So we define it as trauma or injury to the head. There are types of head injury, which is open head injury and closed head injury. Open head injury is when the injury broke the skull, while the closed head injury, it did not break the skull. So the main problem here is about pressure, bleeding, and squeezing of the brain tissue. So the signs and symptoms will evolve also on that main problems, which is of course decreased LOC or level of consciousness, and you should always check as well the position of the patient, like the corticate and the cerebrate. And the management, we should prevent further damage and decrease the ICP of the patient, because I told you earlier, main problem is pressure, which is increased intracranial pressure. So medication is mannitol, which is a osmotic diuretic. It pulls the water from the brain. So dexamethasone is the only steroid that can enter the blood-brain barrier. So this is also very important. And of course, we all know that mannitol reduces ICP and improves cerebral blood flow, pull the fluid from the brain, increase urine output, and level of consciousness. While the dexamethasone, this is a corticosteroid to treat brain injury. It is anti-inflammatory drug. Next is the spinal cord injury. Spinal cord injury is trauma or injury to the spine or spinal cord. Types are complete or incomplete. So when we say complete, both motor and sensory functions are lost, while incomplete, it's either motor function or sensory function that is being lost. So next is the main problem is the sensory and or motor function loss, of course. And signs and symptoms: loss of sensation and movement below the injury, because we all know that spinal cord is connected to each other. So the problem, always remember that the problem will be below the injury. So anything below the injury will be a problem when it comes to the spinal cord injury. So management mostly is supportive management, assistance to the activities of daily living of the patient, and the medication for this is steroid, and methylprednisone is the some research suggests that a corticosteroid injection may help spinal cord injuries. The medication should be given within 8 hours after the injury occurs. This treatment may improve blood flow, preserve nerve function, and reduce inflammation. Alright, so let's now move on with the Q&A or question and answer. In this question and answer, I will show to you how I handle each question. So let's start with number 1. So of course, first I will read the whole question. Number 1, a patient with a spinal cord injury at the T1 level complains of a severe headache and an anxious feeling. Which is the most appropriate initial reaction by the nurse? Number 1, try to calm the patient and make the environment soothing. 2, assess for a full bladder. 3, notify the healthcare provider. 4, prepare the patient for diagnostic radiography. With each question, what I'm doing is I first ask myself, what is the topic all about? So, the topic is all about spinal cord injury. So, it is at the T1 level. It means anything below that is a problem already. And next question to myself is the question asking for a negative or positive answer? Then I will go back to the question, which is the most appropriate initial reaction. So, the most appropriate initial reaction means looking for a positive answer. Because what I mean by negative or positive answer is that if I'm looking for incorrect answer, so that is a negative answer. It means I will look for the incorrect answer on the choices. But right now, I'll be looking for a positive answer, and which is the most appropriate initial reaction. So, keyword is most appropriate initial reaction by the nurse. So, let's do elimination. Number 1, try to calm the patient and make the environment soothing. So, this answer is a calm or soothing environment is actually fine, though not what the patient needs in this case. And then number 2, assess for a full bladder. This is the looking at the 4 answer. This is actually for me the possible answer. Assess for a full bladder, not because there is a word assess, but 3 and 4, if you notify the healthcare provider without doing anything, you have to notify the healthcare provider after assessment, because the first one is most appropriate initial, so you're looking for the initial. While preparing the patient for diagnostic radiography, you need to have the healthcare provider consent first for the diagnostic procedure. So the patient should be seen first by the healthcare provider before you prepare the patient for any procedure. So the answer for me here is number 2, assess for a full bladder, which is the correct answer, because this is autonomic dysreflexia. Autonomic dysreflexia occurs in patient with injury at level T6 or higher and is a life-threatening situation that will require immediate intervention or the patient will die. So the most common cause is an overextended bladder or bowel. Symptoms include hypertension, headache, diaphoresis, bradycardia, visual changes, anxiety, and nausea. So the nurse should recognize this as an emergency and proceed accordingly. Once the assessment has been completed, the findings will need to be communicated to the healthcare provider. So let's move on to the number 2 question. So again, I will read the question. The client diagnosed with a mild concussion is being discharged from the emergency department. Which discharge instruction should the nurse teach the client's significant other? 1. Awaken the client every 2 hours. 2. Monitor for increased intracranial pressure. 3. Observe frequently for hypervigilance. 4. Offer the client food every 3 to 4 hours. So, after reading the question, I will ask myself again, what is the topic all about? So the topic is about concussion, and it's written there, it is mild. That's why the patient is already being discharged from the ER. However, you need to teach the client significant other. So I'll ask myself, is the question asking for a negative or positive answer? So discharge instruction should the nurse teach the client. So the nurse should teach this. So we are looking for a positive answer. So let's check. The keywords is discharge instruction. So number 1, awaken the client every 2 hours. Since this is only a mild concussion, a concussion is actually a type of traumatic brain injury, which I discussed earlier, or TBI, caused by a bump, blow, or jolt to the head, or by a hit to the body that causes the head and brain to move rapidly back and forth, like jarring of the brain. So temporary unconsciousness or confusion may occur. So with this, awaken the client every 2 hours is actually correct, because it allows the identification of headache, dizziness, lethargy, irritability, and anxiety. All signs a post-concussion syndrome, which would warrant a return to the emergency department. However, I still need to look for 2, 3, and 4. Even though I have read them, I will still look for it. Monitor for increased intracranial pressure. Yes, that is possible. However, this is only a mild concussion, and the discharge instruction to the significant other is 1, because monitoring for increased intracranial pressure, mostly you actually need to explain everything about the signs and symptoms that the significant other should look for. But the very first thing that you need to provide is awaken the client every 2 hours. Next, observe frequently for hypervigilance. For this one, this is, although there is a trauma because the patient had that concussion, it's not that needed for this case. Offer the client food every 3 to 4 hours. It is also not needed for this case. So number 1 is the best answer. So 1, awaken the client every 2 hours. Next is number 3. Again, I'll read the question. An unconscious patient receiving emergency care following an automobile crash accident has a possible spinal cord injury. What guidelines for emergency care will be followed? So this is a select all that apply question. For select all that apply question, we need to apply also the true or false. So first, immobilize the neck using rolled towels or cervical collar. 2, the patient will be placed in a supine position. 3, the patient will be placed on a ventilator. 4, the head of the bed will be elevated. And then 5, the patient's head will be secured with a belt or tape secured to the stretcher. So for this kind of question, again, I will ask myself, what is the topic all about? So the topic is all about spinal cord injury, and I will ask myself, is the question asking for a negative or a positive answer? So guidelines for emergency care will be followed. So that's the question. So this is looking for a positive answer. So I should look for positive answers because this is select all that apply. Keyword guidelines for emergency care. Alright, so let's now move on in answering this question using the true or false, since this is a select all that apply. So first, immobilize the neck using rolled towels or a cervical collar. This is, for me, this is true for the spinal cord injury. Then second, the patient will be placed in a supine position. Yes, for me this is true as well. Number 3, the patient will be placed on a ventilator. This is actually possible since you don't know yet which part of the spinal cord injury is affected, but definitely this is once the patient has been admitted. Number 4, the head of the bed will be elevated. This is wrong and opposite of number 2. We also talked about on my previous video that you can only increase the head of the bed of the patient for about 30 degrees for the patient with a head injury, but so this is not yet applicable because you haven't assessed in which part is the injury and if there's any injury also with the head of the patient, because this is an automobile crash accident. Number 5, the patient's head will be secured with a belt or tape secured to the stretcher. For me, this is correct. So my answer is 1, 2, and 5. So that's the correct answer because Rationale is in the emergency setting. All patients who have sustained a trauma to the head or spine or are unconscious should be treated as though they have a spinal cord injury. Immobilizing the neck, maintaining a supine position, and securing the patient's head to prevent movement are all basic guidelines of emergency care. Placement on the ventilator and raising the head of the bed will be considered after admittance to the hospital. Now let's move on to the next question. Number 4, the resident in a long-term care facility fell during the previous shift and has a laceration in the occipital area that has been closed with steri-strips. Which signs or symptoms would warrant transferring the resident to the emergency department? Number 1, a 4 centimeters area of bright red drainage on the dressing. 2, a weak pulse, shallow respirations, and cool pale skin. 3, pupils that are equal, react to light, and accommodate. 4, complaints of a headache that's resolved with medication. So, what is the topic? The topic is about laceration in the occipital area, and we are looking for the signs and symptoms that would warrant the patient to be transferred to the ER. So, is the question asking for a negative or positive answer? We are looking for a positive answer. And the worst answer, this is like prioritization. What I meant by the worst is the worst case scenario because you will bring the patient to the ER. So, number 1, a 4 centimeters area of bright red drainage on the dressing. For me, it's I'm not saying that it's normal, but possibly there will be a bright red drainage because the patient has laceration. But 4 centimeters is not yet that big to be worried about. Number 2, a weak pulse, shallow respirations, and cool pale skin. For me, this is something to be worried about. So this is for me, this is the answer. Number 3, pupils that are equal, react to light, and accommodate. That is normal, so that's not the answer. Number 4, complaints of a headache that's resolved with medication. So since the headache is already resolved with medication, then there's no need for you to send the patient to the ER. So my answer here actually is number 2. Since we are looking for a positive answer, keywords would warrant transferring. So number 2 is the worst case scenario. So that is the answer. Number 2, these signs and symptoms indicate increased intracranial pressure from cerebral edema secondary to the fall, and they require immediate attention. So next is number 5. A patient with a spinal cord injury is recovering from spinal shock. The nurse realizes that the patient should not develop a full bladder because what emergency condition can occur if it is not corrected quickly? 1. Autonomic dysreflexia. 2. Autonomic crisis. 3. Autonomic shutdown. 4. Autonomic failure. So what is the topic all about? It is about spinal cord injury and spinal shock, and about a full bladder that the patient should not develop. So is the question asking for a negative or positive answer? The question is the nurse realizes the patient should not develop a full bladder because what emergency condition can occur if it is not corrected quickly. So this is looking for a positive answer. And the keywords are what emergency condition can occur if it is not corrected, the full bladder. So for the autonomic dysreflexia, for me this is the answer. Earlier this is already my question about the autonomic dysreflexia. Number 2, autonomic crisis, autonomic shutdown, and autonomic failure are not terms used to describe common complications of spinal injury associated with bladder distension. So we should remember that to prevent of a distended bladder when caring for spinal cord injury patients, in order to prevent this chain of events that lead to autonomic dysreflexia. So we should track urinary output carefully, and routine use of bladder scanning can help prevent the occurrence. So other causes of autonomic dysreflexia are impacted stool and skin pressure. So the answer here is autonomic dysreflexia because the other 3 are not associated with this to describe this common complication of spinal cord injury. And I did not discuss this also in my review. Next question is number 6. The nurse is caring for the following clients. Which client will the nurse assess first after receiving the shift report? So 1, the 22-year-old male client diagnosed with a concussion who is complaining someone is waking him up every 2 hours. Number 2, the 36-year-old female client admitted with complaints of left-sided weakness who is scheduled for an MRI scan. Number 3, the 45-year-old client admitted with blunt trauma to the head after a motorcycle accident who has a Glasgow Coma Scale score of 6. And number 4, the 62-year-old client diagnosed with CVA who has expressive aphasia. So what is the topic all about? So the topic is all about prioritization. So the nurse is caring for the following clients, and you need to prioritize which patient you need to assess first. So is the question asking for a negative or positive answer? The question is asking for a positive answer because you are looking for the first one to assess after you receive your shift report. So you will prioritize which patient need you the most. So that's the keywords. Assess first. So let's start. The 22-year-old male client diagnosed with a concussion who is complaining someone is waking him up every 2 hours. So I think this one, you have nothing to worry about because you really need to wake the patient up every 2 hours for a concussion patient, for a patient with concussion. Number 2, a 36-year-old female client admitted with complaints of left-sided weakness who is scheduled for an MRI scan. Yes, you can consider a patient with left-sided weakness that you need to see this. Number 3, the 45-year-old client admitted with blunt trauma to the head after a motorcycle accident who has a Glasgow Coma Scale score of 6. So, the Glasgow Coma Scale is used to determine a client's response to stimuli such as eye-opening response, best verbal response, and best motor response. Secondary to a neurological problem scores range from 3, which is a deep coma, to 15, which is intact neurological function. So, a client with a score of 6 should be assessed. Then number 4, the 60-year-old client diagnosed with CVA who has expressive aphasia. When you say expressive aphasia, it is also known as Broca's or non-fluent aphasia. People with this pattern of aphasia may understand what other people say better than they can speak. So people with this pattern of aphasia struggle to get words out, speak in very short sentences, and omit words. So with this 4 patient, the worst is number 3 because the Glasgow Coma Scale is 6, wherein the highest, the normal one is 15. So we need to assess this patient first. Now let's move on to number 7. Which patient is at highest risk for a spinal cord injury? 1. 18-year-old male with a prior arrest for driving while intoxicated. 2. 20-year-old female with a history of substance abuse. 3. 50-year-old female with osteoporosis. 4. 35-year-old male who coaches a soccer team. So, the highest risk, let's ask again, what is the topic? Highest risk for spinal cord injury. So it's like we're looking for we're prioritizing which is the patient for highest risk. So is the question asking for a negative or positive answer? We're looking for a positive answer, and the keyword is highest risk. So let's now answer this question. Number 1, 18-year-old male with a prior arrest for driving while intoxicated. This is a possible answer because most of the patient with a spinal cord injury is because the cause is due to motor vehicle accident. Next is 20-year-old female with a history of substance abuse. But checking on this question, I checked on history, so it means it's already done. The patient is not using substance abuse anymore, so it's already history. So for me, this is not the answer. Number 3, 50-year-old female with osteoporosis. Osteoporosis is about bones. This is not the answer, although possibly the patient will have injury, but it's not the highest risk. Number 4, 35-year-old male who coaches a soccer team. Although this 35-year-old male is in the soccer team, we all know that if you're a coach, mostly you're fit. So for me, the highest risk here is 18-year-old male with a prior arrest for driving while intoxicated. So my answer is 1. So that is the answer, because there are the three major risk factors for spinal cord injuries are age. So the patient is young, and then gender, higher incidence is in males, and alcohol or drug abuse. Although the patient has history of substance abuse, females tend to engage in less risk-taking behavior than young men. So let's move on to number 8. A patient is receiving mannitol for increased ICP. Which statement is incorrect about this medication? So number 1, mannitol will remove water from the brain and place it in the blood to be removed from the body. 2, mannitol will cause water and electrolyte reabsorption in the renal tubules. 3, when a patient receives mannitol, the nurse must monitor the patient for both fluid volume overload and depletion. 4, mannitol is not for patients who are experiencing anemia. So what is this topic all about? So the topic is about mannitol and for increased ICP. So this is still under head injury. So next is the question asking for a negative or positive answer? So reading or going back to the question, which statement is incorrect about this medication? So incorrect means we're looking for the negative. So we're looking for the negative answer. So it means there are 3 correct answers there. So the keyword here is incorrect. So let's now answer. Mannitol will remove water from the brain and place it in the blood to be removed from the body. That is right. Mannitol will cause water and electrolyte reabsorption in the renal tubules. So for me, this is the answer. This is wrong. And number 3, when a patient receives mannitol, the nurse must monitor the patient for both fluid volume overload and depletion. This is correct. Mannitol is not for patients who are experiencing anemia. Number 4, this is also correct because we are using the kidney because we are removing the water or pulling the water from the brain. So the answer here is number 2. Because all the other options are correct. Mannitol will prevent, not cause water and electrolytes, specifically sodium and chloride, from being reabsorbed. So hence, it will leave the body as urine. Number 9. So, a patient with a spinal cord injury or SCI has complete paralysis of the upper extremities and complete paralysis of the lower part of the body. The nurse should use which medical term to adequately describe this in documentation? 1. Hemiplegia, 2. Paresthesia, 3. Paraplegia, and 4. Quadriplegia. So, what is the topic? So the topic is about SCI or spinal cord injury, and mostly this is about definition of terms. In NCLEX, it's important also to know the term. So let's answer this. Is the question asking for a negative or positive answer? So in this question, they are looking for positive answer. So the nurse should use which medical term to adequately describe this in documentation. So we're looking the positive answer. So keyword is adequately describe. So let's answer this. Number 1, hemiplegia. Hemiplegia is actually paralysis on one side of the body. Number 2 is paresthesia. Paresthesia does not indicate paralysis, as you can see on the question. We're looking for the complete paralysis of the upper and lower extremities. So paresthesia is actually an abnormal sensation, typically tingling or pricking. There could be pins and needles caused chiefly by pressure and damage to peripheral nerves. So number 3, paraplegia is actually a paralysis of the lower body. So the answer here is for quadriplegia. Quadriplegia describes complete paralysis of the upper extremities and lower extremities. So, number 10, the client is admitted to the medical floor with a diagnosis of closed head injury. Which nursing intervention has priority? 1. Assess neurological status. 2. Monitor pulse, respiration, and blood pressure. 3. Initiate an intravenous access. 4. Maintain an adequate airway. So, again, we'll ask ourselves, what is the topic all about? So, the topic is about closed head injury, and we're looking for the nursing intervention, the priority nursing intervention. So, is the question asking for a negative or positive answer? The question is asking for a positive answer because the keyword is the priority intervention. So, let's start answering this. 1. Assess neurological status. Yes, possibly. Should assess neurological status. Number 2, monitor pulse, respiration, and blood pressure. Yes, it's also included in our nursing intervention. 3. Initiate intravenous access. Yes, it's also included in our intervention. 4. Maintain an adequate airway. But we need to prioritize. Which is our priority? With all this question, our priority, of course, is the airway. So the most important nursing goal in the management of a client with a head injury is to establish and maintain adequate airway. So number 4 is the answer. Thank you so much, guys, for watching, and don't forget to subscribe on my channel, and I'll be posting more about my nursing review materials. On my next video, I'll be reviewing the epilepsy and seizures. And for the following days, I'll be posting all my review materials, and hopefully I'll finish within 3 months because actually a friend of mine is already asking me to post all my review, but I'm still studying it and checking it against the 2022 reviewers, because remember that I took the exam 2020 and it's already 2022, so I'm checking it so that it will be updated. So thank you so much again, and hope to see you guys on my next video. Bye.